Hello friends, in this video I will talk about dementia. Dementia is gradual and gradual and gradually and gradual loss of the ability to think and remember things in day-to-day life. There are four different types of dementia. One is Alzheimer's disease, and one is Alzheimer's disease, and Alzheimer's disease. Another is vascular dementia. Third is frontotemporal dementia, and the fourth is Lewy body dementia. In Alzheimer's disease, there are development of plaques and tangles in the brain responsible for the disease. In Alzheimer's, in Lewy's bodies, the protein cells grow within the nerves and damage created to the brain by this type of process. So the disease develops in this way. In vascular dementia, the patient is suffering from diabetes or strokes, and hence his brain is not functioning properly. And the fourth is frontotemporal dementia, in which there is a destruction of the nerve cells which are responsible for the formation of neurotransmitters, and hence the behavior of the person concerned is affected. In Alzheimer's disease, patient becomes more forgetful. It is normal to become forgetful in day-to-day life, but when this forgetfulness is messing up with our daily life, and this forgetfulness is much distressing, then we should think that the patient is suffering, that the person is suffering, must have Alzheimer disease. First of all, one of the major symptoms in the Alzheimer disease is short-term memory loss, and this happens because in Alzheimer disease, the hippocampus, which is responsible for the short-term memories, is has been damaged by the disease process. Second, semantic memories of the patient has been semantic memory and semantic memory and language has been affected by the Alzheimer's disease. In Alzheimer's disease, patients suffer from visual symptoms. He is unable to recognize familiar faces, so that is quite distressing. In Alzheimer's disease, when the damage spread to the frontal lobes, then decision making and becomes decision making, planning, organizing becomes more difficult. In Alzheimer's disease, long term abilities of which he gained long term ago, like dancing, playing piano, farming, has been retained, because these are the memories which are stored deep within the brain system. So first sign of the Alzheimer disease, what you consider that there is a short-term memory loss. Patient is low in mood. Family is aware of the things. things. Family is aware of the things. Reasoning, patient is unable to communicate, because he is not aware, because his memory has been he's unable to compare and struggling, and patient is unable to conversate, and he's struggling with words to remember which word for which thing. So he is not fit for a conversation. So second type of this is the Alzheimer's disease, and second type of dementia is vascular dementia. In vascular dementias, like in diabetes, memory loss is not an early symptoms. Planning and decision making is affected first. Depression is more pronounced because the insight to the disease is present. Inside the disease is present, brain, the patient knows that he is suffering from a stroke or whatever the symptoms is. In Lewy body dementia, when microscopic particles develop within the nerve cells and causing nerve cells to become damaged by this, so the patient develops Parkinson's disease like symptoms, or Parkinson's disease: slowness of movement, stiffness, tremors, difficulty in judging distances, fainting, visual hallucinations, delusions, and paranoia. You can better check paranoia in Wikipedia. In frontotemporal dementias, memory has not been affected, but it causes behavioral changes or language skills. Recent memories are unaffected. Patient is becomes selfish, behave rudely, easily distracted, loss of loss of inhibition, shouts in the public, and he develops liking for the sweet food. So by discussing these type of dementias, what my message is that when the person's intendant, person's family is seeing these type of things with the patient, he should they should take a advice from the doctor, and doctor should not put the patient directly on a psychiatric medicines. First of all, he should rule out the dementia by making an MRI, taking an MRI. If the patient is not suffering from dementia, then further treatment of psychosis, depression, or other psychiatric illness can be taken. But before a psychiatric medicine to be given to a patient, which sometimes causes more severe damage, for severe adverse effects in the dementia, in the patients who are suffering from dementia, we must rule out dementia. After ruling out dementia with an MRI, or a clinical checkup, we should go for a psychiatric medicine, not a psychiatric medicine first before ruling out dementia. So thanks for watching my video, and good night.